Good day. It is indeed a very privileged moment. ARC in the last few months, especially in the last 2 months, we have opened 4 hospitals in 3 different Indian states and 1 in an international country. We can say it is a big milestone and it is a very dynamic record in Indian history. None of the fertility centers in this over the last few decades have achieved this sort of history in India. That is what ARC has done. We have opened our Cochin center in September first week and our Gudu center in second week of September and our Kolkata center in third week of October, and we are launching our Sri Lankan center in November midweek. So this is something many of us would have got astonished, and many couples were really asking me this question: how is it this possible, and will we get the same amount of support and personalized care as what we were getting in ARC earlier? Definitely ARC is in the forefront of fertility training as well as in reproductive medicine. We ensure that before starting any branch, the existing branches are doing well in terms of all the manpower and the system. We believe in a very strong system. That is what rolling on ARC. The system what we have defined is very very protocolized and very unique. Many people would have been surprised to know this, how we have incorporated such system. It's a very rigorous system and it is a continuous monitoring. All these 15 branches are closely monitored on a day-to-day basis. Any couple who's stepping out of ARC, if they are not convinced, they are open to so many opportunities according to their standard levels to reach the management. That is the speciality of ARC. A patient who is coming from a low socioeconomic background, who is not having enough of medical educational knowledge, who cannot use the mobile effectively, he can straight away call the call center and put a request, and the complaint will be directly lodged to the branch group where the senior members are accessing. So this is one type of patient who are reaching them. When some patients are reaching in level 2 and level 1, who are educated, who are qualified and who have good knowledge, they are easily able to reach us, because as soon as after they step out of ARC, they are getting an SMS, they are getting a call feedback, and over and above they are accessible. When they step out, they are asking in Google, how was your experience in ARC? So they are easily exposed, and it is all these things. To be very honest, I personally have a very close to monitoring. So whenever there is a small negative review, I take it very personally. I take it to the branch. I identify what is the deficiency of service, and we see to that service, that sort of deficiency should not happen for any couples in the future, and we try to improve our services day by day. So please be rest assured, though ARC is opening very fast in many locations, still our services are not compromised. Rather, we can tell our service has improved a lot. That is what the ARC is doing. Now in Sri Lanka, the same system will happen. Patients have got here in Sri Lanka, many of them are familiar about ARC and they know how we have done the success stories in India, and the same replication will take place in Sri Lanka. So be rest assured that when we come to Sri Lanka, we ensure that you get the best of the care, and most important is what we are going to tell is, so far we have seen many couples who have undergone treatment in Sri Lanka. In terms we have gone through, we have identified what is the expectation of the couples from the clinician side and what is the services offered by the clinicians. We have identified good and negative qualities. We will definitely ensure that good qualities will be maintained, and the negative points from the clinician perspective and from the patient perspective and from the couple perspective is taken in the right sense. We identified those gaps, and those gaps will be definitely addressed. And when ARC is coming into Colombo, it is a very big welcome note for all the childless couples. Rest assured, we see you soon. Thank you.